Hi, everyone. Welcome to MGFA's Wellness Series webinar, Sleep Hygiene and MG. I'm Jenna Umballo, and I'll be moderating today's session. Before we get started, I'd like to go over a few housekeeping items. Please type your questions in the Q&A box located at the bottom of the Zoom menu bar, and we'll get to them during the Q&A segment. Today's session is recorded and will be available online. I'd like to give special thanks to our sponsors, Alexion, Argenix, UCB, Janssen, Cabaletta Bio, and Horizon. We've got a great presentation ahead of us today, and now it's my pleasure to introduce our speaker, Andrea Eddleman. Welcome.
Hi, thank you, Gina. Thank you for the introduction. Okay, so my name is Andrea. I'm a respiratory therapist on a multidisciplinary team at Loma University Health. I've been working in neurology for about the past 6 years, so it's something I'm very excited about, and I hope you take something home with you today that I can help you out with and help you with your sleep. Let's go ahead and go to the next slide. I also am an educator for Hillrom. I'm non-biased regarding any particular equipment or brand, and this is for educational purposes only, so refer to your doctor for any medical advice. Okay, so we're going to dive into not just myasthenia gravis and sleep in general, but how the disease and your sleep are interacted, where we're going to cater it a little bit more towards the myasthenic patient versus just in general. Myasthenia gravis causes fatigue, extreme tiredness, as we all know. At the same time, many of these people with autoimmune disease have trouble sleeping. Common sleep disorders are excessive daytime sleepiness, insomnia, restless leg syndrome, and sleep apnea. Poor quality can affect the daily life and overall health of someone with myasthenia gravis. So not only is it quality sleep, but it's quantity of sleep as well. So we'll go ahead and move to the next slide. So these are a few, let me just scoot this over for a second. Here is a few studies and information that I wanted to really cater to the myasthenic patient when it comes to their sleep. Myasthenia gravis states that patients often have problems either with their quantity or quality, as we had mentioned, and they experience insomnia and sleep apnea. Now, gravis does not necessarily cause these symptoms directly, but these sleep problems may be brought on by medications or quality of life or inactivity due to the disease. So it's not necessarily the disease itself that causes the sleep problems. It's everything else that's involved within the disease that causes these problems. Depression caused by living with a chronic autoimmune disease can also take a toll on one's body. Myasthenia gravis News back in 2019 published in a journal the study they had. Participants underwent an overnight polysomnography test, a sleep study. And the results showed that our MG patients with obstructive sleep apnea are 11 times more likely to have OSA specifically than a normal person without the disease. So you are at higher risk for that. Findings of the study indicated that proper treatment strategies for OSA myasthenia might eventually lead to better oversleep in our patients as well. So what is sleep apnea? Sleep apnea is potentially a very serious condition in which repeatedly stop or start breathing in the middle of the night. You can feel tired all throughout the day. You're waking up probably because you're air hungry, loud snoring, gasping for air, sore throat, headache, attention problems, irritability. Those are all associated with sleep apnea. Apnea can also contribute to high blood pressure, diabetes. There's actually two types of sleep apnea that I think commonly get confused. They both can cause excessive tiredness and keep you from getting a good night's rest. These types of sleep apneas are obstructive sleep apnea, where the tissue in the back of the throat relaxes and your sleep and partially covers your airway. So the laminar flow of being able to breathe in and out is obstructed. When our muscles become weak with MG, we know that we're at high risk of occluding our airway. So obstructive sleep apnea would be an example of that. Now, central sleep apnea, this happens when the brain doesn't send to the right nerve the signals to the muscle, and then that controls your breathing while you sleep. So that's a brain signal that we're losing in centrals and obstructions. Okay, go ahead and go to the next slide. So how do we define daytime sleepiness? A lot of doctors will give you an Epworth sleepiness scale. It's one of my go-to kind of scales when I see my MG patients to see if we're high risk for poor sleep hygiene. And then we kind of take that from there. You could also do a multiple sleep test. You guys, there's quantitative assess daytime sleepiness diagnostics. And then there's also EEG recordings. That's where you get the probes on the head and then kind of monitors the brain waves and so on and so forth. But these are all just quick little tests that we can do. I like to do the screening tool with my patients because the Epworth sleepiness scale can kind of give us an idea of where we're going and what we need to do from there. Go ahead. So excessive daytime sleepiness and restless leg syndrome are two very huge diagnoses that are associated with the MG patient with poor sleep hygiene, and more particularly to that, catered to that. So restless leg syndrome causes irresistible and uncomfortable urge to want to kick your legs. You may be lying down peacefully, and then you feel like you have this throbbing sensation that you want to jerk your legs or move them around. It makes it so difficult to fall asleep. And then if you're having a hard time with you falling asleep, then you result into excessive daytime sleepiness. It's not clear what really causes RLS. In some cases, it's been affected up to 10% trusted source by the US population. That's a genetic component, while other research says it could be low iron that is to blame. Many scientists believe that problems with the brain as well, the regional responsible for movement, are also reflected with RLS syndrome, but we don't know. We don't have a definitive understanding as to why a patient gets RLS, but it's more common in the MG patients. Okay, so medications that patients take with MG to treat insomnia and acute anxiety are listed below, but there's one take home here that I really want you guys to pay attention to. Z drugs. I want you to avoid your Z drugs, your benzos, anything like that. If you're currently on one of those, that will suppress your respiratory drive. If we don't have late onset methadone or something else going on with you, then anything that would impair the breathing, I think is kind of scary for my MG patients. So if you run the list, you can look them down, see if you happen to have anything on there, and then you can kind of get an idea as to what are the potential outcomes of that drug that's helping assist with these sleep complications. Okay, so sleep doesn't always just affect the RLS, the daytime sleepiness. It can affect your weight, your brain, heart, immune system, quality of life, and quantity actually of life. So to dive in a little bit deeper on these, we'll go ahead and go to the next slide. Weight. Many studies have been done in relationship with weight and sleep. People are more concerned that at night, the insomnia patients have a hard time losing the excess weight. Chances are you could be obese with severe insomnia. They're not helping your weight problem by not getting the proper sleep. You need at least 7 to 9 hours of sleep. The reason for weight gain is no longer you're awake and hungrier, you'll become. So your body needs energy to keep going. And if you're staying up long hours, the more energy it's going to require to accommodate those drives. So great sleep, 7 to 9 hours. Now, your circadian rhythm isn't necessarily doesn't necessarily matter what time of day it is. Your circadian is your own natural sleepiness and wake up times. Typically, it's 2 p.m. and 2 a.m. ironically, but a lot of people say go to bed at 8, but your circadian rhythm is what is comfortable for you. And I don't want anybody to get that confused. As long as you get solid sleep, it doesn't matter what time of sleep that is. It's just got to be solid sleep. Okay, go ahead. The brain. Okay, the first signs that you may be aware of getting less than 6 hours of sleep. You feel tired, forgetful, irritable. You're just not on top of your game. Yet in long term, it shows to everyone that you have bad job performance, mood swings, depression. And so the brain really gets affected by that. Actually, there was a study done by Mental Health Foundation that found that people that didn't get enough sleep were 4 times more likely to suffer from lack of concentration, relationship problems, and 3 times more likely to be depressed, 2.6 times more likely to commit suicide. The bottom line is the brain is functional and critical. Without proper sleep, the brain cannot regenerate properly. Then with time, it'll literally take the best in the end. So you may not see these small subtle side effects now, but with continuous lack of sleep over time, you will start to see its effects. Okay, let's talk about your heart. This statistic is overwhelming, but University of Warwick did a study and they found that getting less than 6 hours of sleep on a continuous basis makes you 48% more likely to have heart disease and 15% more likely to develop a stroke, okay? Those numbers are huge, 48% more likely to die of a heart disease because of lack of sleep, something that is a small fix that we can gradually work on over time. If you're over the age of 65, then you are 83% more likely to have high blood pressure, which increases your risk of heart attack and stroke. So if you're my MG patients that have sleep apnea, 11% more likely to have these apneic episodes, then your number just gradually increased from 83% to a whole nother level. So it's so important that you get these studies done or you pay attention to the triggers of having poor sleep hygiene. Go to the next. Immune system. Another interesting correlation found that when you sleep deprived, your immune system is weaker. We have autoimmune disease, first discovered by testing on rats and humans, and then worked on night shift patients. And then bad sleeping habits are more common in night shift workers. So if you are my MG patients that work graveyard, okay, keep that in mind because you don't want anything to do to take a toll on that. And then obviously working night shift, it's hard to get a good night's rest during the day unless that's your natural circadian rhythm. Go ahead and go to the next slide. And then length of life. Again, many studies have been completed in relationship to longevity with sleep. One Professor Kevin did, he did sleep research that shows that 7 to 9 hours of sleep a day, those patients live longer who sleep shorter or even longer. So you're 12% more likely to pass over a 25-year period if you're not getting at least 6 hours. I know it says 7 to 9, but I like to tell my patients at least 6 solid hours, okay? So let's talk about what we can do for the MG patients. And I'm super excited about this part because a lot of people say, oh, nighttime breathing machine, I did a sleep study and I didn't have sleep apnea. Guess what, guys? With your diagnoses and the proper documentation, you could get equipment. Now, the reason why I'm so excited about that is even if you don't have severe sleep apnea, obstructive sleep apneas, or anything like that going on, even though you're 11% more likely, the BiPAP machine can save your life. If you are getting an onset coming on or a crisis, and you put that BiPAP machine on, it until hold you over before 911 comes or you get your medicine on or something like that, it's going to deliver the breath it needs. It's going to expel the CO2 that is required, and it can save your life. Having a BiPAP machine as an MG patient on backup, even if you don't have the severe sleep apnea, is a great idea. And I can't stress that enough to my patients, okay? Yeah. How you qualify for these things, if you don't have the sleep apnea, say you went to the sleep study, when you feel a crisis coming on, you make your appointment or you skip your medicine or your medications that morning, and we do a vital capacity test. We show in our documentation the potential risk. We always want to be proactive instead of reactive. So if we can see the vital capacities when your onset weakness is below 50%, then we can get you that BiPAP machine that could change your life and save your life. Same things go for suction machines. I don't know if a lot of patients know about this, but if you're going to hear this often, bulbar weakness, this area here is all your bulbar region. If that's weak, and you brush your teeth, do something like that, and it's hard for you to get back on track with the strength of that, a suction machine is highly beneficial. You guys, just like at the dentist, you just hold your lips around it and it'll just pull all that mucus and phlegm or toothpaste, even whatever you want to use it for. Just know that you have it. And it's something that with the diagnoses, Medicare will cover or you qualify for these things, just to make life easier. And then a cough assist device. It mimics a strong cough. All you need is to document in the charts why it's beneficial with your diagnoses and what the potentials are. Now, a cough assist device can really set the tone for the patient at night if they have a lot of phlegm or junk and they're weak. It pulls all that out, and then you get a good night's rest. And then you have your BiPAP machine that's doing the work for you. So now you're not so exhausted, and you get a good night's rest. My MG patients also should keep in mind that when you wear a BiPAP machine and you're tired or weak, put it on when you're watching TV. This machine, yes, says nighttime breathing machine, but if you feel tired and you're struggling, put on your equipment, use your BiPAP machine, even throughout the day. It doesn't have to be for sleep. Okay, so the cough assist, I said, likes to set the tone for the evening. What a cough assist does is it delivers a nice, big, deep breath to help expand your lungs and open up those alveoli. A lot of MG patients are very restricted because they're limited to how much they can do. So this machine, it'll deliver a nice big breath, open up the alveoli, allow you to breathe well. And then it goes, and it has a nice good suction, if you will, that will pull up anything when this area is weak, up and out. So you don't have the fear of choking. You don't have the fear of something just stuck in there and you're trying to throat clear and it's difficult. So if you're someone who gets that kind of way, right before bed or early in the morning, cough assist device is highly beneficial. And with the diagnoses and the proper chart notes, it's something that my MG patients can really use and take advantage of. I don't know where the rest is. It doesn't show up. Oh. Hold on, Gina. That went kind of quick. Does anybody have any questions, or is there anything else that we could discuss? We can make it more of a Q&A kind of conversation, if you will.
Yeah, we have a couple of questions already, so we can dive right into that. The first one is, I sleep a lot during the day and I'm awake at night. How do I change that?
Routine. A good routine is very important. Take your alarm clock out of your room. Believe it or not, the fear of always wanting to check the time is a problem. Limit your screen time an hour before and after bed, before you tire, because the blue light from your screen inhibits your natural production of melatonin. Melatonin is what that homeopathic, all natural that some people take. I think it's even on the medication list, but your natural production of that is inhibited if you're watching TV to fall asleep. And then the medication list and a good plan with your provider to kind of titrate all your needs is there for you. I actually have a list of, I thought it was at the end of this, that was tips for a good night's rest for the myasthenic patient. And so I will definitely pop that up and make sure that everybody can have the opportunity to see that list.
Okay, thanks. This other question is, my machine keeps my partner awake at night when I have to get up and work in the morning. Are there quieter options available?
That's a great question. And I think it really matters what style machine you have or what type of machine you have. So there's all different kinds of, BiPAPs or NIVs. You might hear that word often, non-invasive ventilators. It works just like a BiPAP, but it has a different setting and mode. Whether one's more quiet than the other, that I couldn't tell you, but I do like the Astral, but then again, I'm non-biased, and if you have a lot of water in your tubing, that can make it loud, a lot of condensation in the tubing. If that's a problem, there's drain traps, but there's also like socks, if you will, that you can put over your tubing, because a lot of times if the room's really cold and you have that warm laminar flow flowing through the machine, the condensation can accumulate in the tube. So gurgling can happen as well. I'm not sure if that's an issue or not, but taping a pillowcase around that could be an easy, quick fix for you.
Thank you. Is sleep medication problematic with MG?
Yeah, it can be. Absolutely. There's a lot of contraindications to that because of our respiratory drive being suppressed. If we already have a suppressed respiratory drive and then we're on certain sleep medications, then we can have those issues. The Z drugs, keep in mind your benzos, those drugs are the ones we try to avoid. So if you notice in your personal prescription list, you have a lot of Z drugs, then highlight those and bring them back to your provider and say, hey, can we addend these, or do you think these are working for me? And see what advice they give you. Sometimes the benefit can outweigh the risk.
Okay. I have a CPAP and I wake up with anxiety attacks. I've been telling my sleep doctor I need a BiPAP, but because my air report says I'm sleeping well, she won't change it. What can I do to get one?
Yeah, I'm so upset that they do that to you because your diagnoses alone with the MG diagnosis allows for a BiPAP. And the reason why I favoritize a BiPAP versus a sleep app for my patients is because bi meaning two, right? We got two pressures. It stents open the airways, allows proper gas exchange, and you eliminate CO2. When you guys are suppressed and you don't inhale and exhale as much as you should, what happens over time is that CO2 at the bi level, it helps elude. CO2 can accumulate on a CPAP. Although it does give you that laminar flow to get a deep breath, it's not expelling the CO2 that you require. So I would definitely bring that up and talk to them about that and say, but my myasthenia, really would be beneficial if we discuss BiPAP versus CPAP.
Great. This next question is, are there better sleeping positions for MG patients?
Yes. Okay. So if something called severe orthopnea or orthopnea, if you hear that word, it's when you lay flat on your back and you have a hard time breathing. A lot of times patients have to prop themselves up or they sleep on their side. Okay. I prefer, if you're on a BiPAP or any breathing apparatus, to be slightly elevated. Some patients who can't breathe sleep all the way sitting up. Those are your recliner sleepers, if you will, if you hear those stories. If you're one of those people who are sleeping up in a recliner and you don't have equipment, that's a red flag. So elevate slightly at like a 30-degree level, I think, or to your side, depending on if you have that severe orthopnea. But once again, when we become weak, our tongue becomes flaccid, and then that can occlude our laminar flow of the air going in. So propped up or to your side, but not completely propped up like you're in a chair. 30-degree angle, 30-degree angle.
Okay, great. Are there any apps or tools I should use to monitor how I'm sleeping at night?
So there's a lot. There's little rings you can put on. There are finger, things. So there's different types of sleep studies too that the MG patients, I'm not too sure they know about. You don't necessarily have to go to a sleep lab and stay the night somewhere and have all those probes on you. Although our MG patients do have severe RLS compared to normal patients and central and obstructive apneas. So the sleep lab will tell us in depth the sleep report. But if you think that you need a machine, or I think everybody should have a machine no matter what, because it could save your life. So you need that machine, even if it's sitting in your drawer. Okay. But if you need to qualify to get a machine, you could do an in-home sleep study or ambulatory sleep study. Ask your doctor for one of those. You go pick it up. And sometimes you can put a band around and a little cannula. And then as you exhale, it'll know if you're expelling the right amount of CO2 and you're breathing appropriately. And that's something you can do in a matter of 4 hours at home. It'll record your sleep to qualify you for those machines.
Great, thank you. So it looks like those are the questions we have. I wanted to see if you have any other just comments or tools and tips for the listeners.
Yeah, I'm very passionate about finding an MG partner care multidisciplinary team clinic in your area. because I do think it's all encompassed care, not just your breathing, but your physical therapy, occupational therapy, your speech language pathologist, a counselor, have all those available to you all in one stop shop. And the Myasthenia Gravis Foundation of America has these centers of excellence, if you will. And I'm proud to say that Loma Linda is one of those. And our patients, man, we're proactive, not reactive. So make sure that you really take advantage of that and get yourself in a good multidisciplinary team, even if it's just once every, 3 to 6 months, you pop in and see those people. Very, very important. Mm-hmm.
Yeah, thank you. And you can check out a list of providers by listed state by state on the MGFA website. We did get another question about sleeping on an airplane or when traveling. What are your thoughts about that?
So a lot of people have a misconception that airplanes, because of the elevation, but the airplanes are pressurized. So don't be fearful of flying. That's not an issue. And you can bring your machine if you have one on a plane. And I have TSA information. If you would like that, I can provide that to you guys as well. To make it more of a streamline. But don't be concerned about your breathing when you're elevated, because those airplanes are pressurized.
Great, thank you so much.
Mm-hmm.
Before we go, I wanted to just let everybody know about 2 things going on with the MGFA that we think would be helpful resources. The first is we have our stakeholder survey available on our website. It takes about 10 minutes to fill out, and we're asking for your input and insights into everything from how the program is being run, how programs are being run, to areas of focus. So we'd really like your input there. And the second thing is that we've launched an online community, which is an area for people with MG to connect with one another. We have chats, but we also have a ton of resources available on there that includes everything from research updates, ways to manage your MG, and video recordings of even these wellness series webinars are available on there as well. So we hope you'll check those out too. Andrea, I wanted to thank you so much for your time today and for your presentation. Thank you for all the information, and I wish everybody has a great rest of their day.
I just wanted to say, if you guys have any other further respiratory questions or any questions that you may have with MG and your breathing, I'm happy to answer, and I'll leave my email in the chat box for everyone. So if you do come across something and you want any kind of additional insight or have any questions you can think of later, I'm happy to answer those for you.
Wonderful. Thank you.
Yeah. Thank you so much. Thanks, Gina. It was fun.
Yeah. You put your email in the chat so everybody can see that.
Yeah, let me see too. There you go. It's afritsch@llu.edu. It's afritsch@llu.edu.
Wonderful. Thanks so much. All right, everyone. Thank you. Have a great rest of your day.